issues that we're having currently. Hopefully we figure it out, but luckily I know that you all can hear me. Feel free to use the chat if you need to. But I'm Jen Loughran. My pronouns are she, her, hers, and I am the Director of Diversity, Equity, Inclusion, and Belonging at Horizon Health Alliance. So I just want to start and say happy Pride Month and happy Juneteenth. But we are going to jump right in. Okay, so this is my hopes for today's agenda. So I'm going to talk a little bit about why we're here, review some common terminology. We're going to talk about some challenges and barriers that the LGBTQIA plus population faces, but more specifically around what the trans and gender diverse populations face, share some positive outcomes, and review some best practices. Also, before I go into any of that, though, I like to first start off and share that I'm presenting on this topic as a straight cisgender woman. I'm also coming from a place of cultural humility, meaning that I don't pretend to be an expert on this subject or this population. So I'm sharing what I've learned in my experiences of working in behavioral health as someone who has worked with this population as the director of DEIB and as someone who has friends, family, and colleagues who belong to this population. So I always want to make sure that that is known. So I have some agreements that I'd like to review, and these are really for not only for this presentation, but really after the fact. So if you should start to have discussions around this topic with other people to have similar agreements as well. These are meant to really create a learning environment that is open, safe, and supportive. So first, allow yourself to be present. So we all have a lot going on, whether it's personally and or professionally or technically right now. But I hope that for the next hour or so, you can truly be present with me here. Confidential. So if there's time for sharing, what is said here really should stay here unless you want it known. And FYI, the info I'm going to share is that I want this information to be known. But allowing for confidentiality can help build trust. Which will also lead to the next agreement of just allowing yourself to be vulnerable. It's okay to make mistakes. That's how we learn. Get comfortable with the uncomfortable. I'm sure you've heard this maybe at a few other DEIB talks. But if we're not even a little bit uncomfortable, then we're probably not having the right conversation. I do ask that that you ask questions if you're not sure of something, but we might not have a lot of time at the end. So if not, that's okay. I'm going to have my contact information at the end, so you can always reach out to me after if you weren't sure about something. I'm going to ask that everyone is respectful. So it's okay to have differing opinions, thoughts, and perspectives. That's really the whole point of diversity. However, if and when we express these differences, just please remain respectful. Be patient. So this is really be patient with yourself and with others. We're all coming from different backgrounds, experiences, and levels of understanding. And lastly, just be honest, mostly with yourself. I'm not going to know if you're being dishonest for the most part, but if something doesn't feel right, if I've done anything or said anything to hurt you, please let me know. And if others have done something or said something to you that hurts, please let them know, because we can't learn if we're not aware of something needing to be changed. Okay. So I do want to start off with explaining why I'm presenting on this topic, aside from it being Pride Month. But individuals who are part of the LGBTQIA plus community are disproportionately affected by behavioral and physical health risks compared to the general population. They have a higher risk of health disparities, often due to stigma and discrimination from the healthcare system. And one contributing factor to this is the lack of knowledge and cultural awareness of providers. The rates of mental health disorders, substance use disorders, and suicide are also higher in this population, but even more so within the BIPOC community. So that's Black, Indigenous, and people of color. Despite these barriers and challenges, though, with increased knowledge and understanding of how to provide gender-affirming care, some of these barriers and challenges can be reduced with the goal of being eliminated. So I don't expect anyone to be competent after this training. However, I hope that you do come away with a little more knowledge and understanding so that we can provide the best care to those we serve. So, I'd like to start off with an overview of two cultural frameworks, cultural competence and cultural humility. So, you might be a little bit more familiar with cultural competence. It's an approach that is still commonly used, but this approach focuses on acquiring enough knowledge to become an expert in someone's culture, thereby believing we're an expert on that individual. So, by taking this approach, it supports the myth that culture doesn't change, which isn't true. So next we have cultural humility. It's a little bit of a newer perspective, but I see it much more frequently now. And this perspective of cultural humility is attributed to doctors Melanie Turvalon and Jan Murray Garcia. So, taking this approach is an ongoing process. It involves a journey of self reflection and introspection. Taking this approach focuses on trying to learn with and from others while not taking on that role of expert. Cultural humility recognizes power dynamics and power imbalances and understands the need to fix these imbalances by developing partnerships and advocating for change. So, taking a cultural humility approach not only involves personal accountability, but also institutional accountability. And ultimately, cultural humility has no endpoint. So, it's a lifelong journey for us to learn about others, but also to learn about ourselves. Questions so far? I'll ask throughout just in case. So, feel free to use the chat. And like I said, hopefully, we'll have some time after as well. Okay. So, in order to provide gender affirming care, I should probably start with what it is. So, according to the World Health Organization, gender affirming care encompasses a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity when it conflicts with the gender they were assigned at birth. Identity can fall anywhere on a continuum, and so can the interventions designed to treat those in need of service. The interventions can include anything from counseling to changes in social expression to providing medications such as hormone therapy and to surgical procedures. In terms of surgery, this just isn't limited to chest and breast surgery or genital surgery, but it can also include various facial surgeries like hairline and brow, eyelid, midface, nose rhinoplasty, jaw and chin, and even a tracheal shave. Um, I also want to point out that in the social care category, I have letting in process at the top. So this is newer language, so you might not have heard this yet, but it's used instead of saying coming out process because letting in gives more power and ownership to the individual. Okay. So language matters. Language we use every day is important. It has the power to define ourselves and it helps us connect with others. Listening to and using the chosen language styles and word choices of others when communicating with people can help create a more welcoming space for conversations and deeper relationships. So, there's a lot of language that's out there and it's constantly evolving. So even though I'm going to go over some common terms with you today, these might eventually be outdated. Some of them have already been outdated in the time that I've been in this role. So it's always important to take the lead from the individual you're working with or being around and to continue to educate yourself. So the next few slides are a few terms and definitions. And at the end, there's also a handout that is available for you so that it will include all of these terms and definitions as well. Okay, so there's a lot of terms out there. And an individual may not identify with them or these definitions. So again, make sure to just follow the lead of the person that you're with. So first we have, so these are some common abbreviations, and we've seen the LGBTQIA+. So this stands for lesbian, gay, bisexual, transgender, queer and questioning, intersex, and asexual. And you might have also seen a variation of this as a 2S in the acronym as well. The 2S stands for two-spirit, and I'm going to go into an explanation of that as well. But then you have the plus sign, which really acknowledges the diversity of identities, orientations, and expressions of the LGBTQIA plus community. So the plus can signify other identities such as agender or gender fluid, gender queer, gender diverse, pansexual. There's a lot out there. So I am going to go through a few of those terms just so you can understand the differences because they are all distinct within their own within that individual and for that group. Um, Next, we have SOGI. So SOGI stands for sexual orientation, gender identity, and gender expression. Oftentimes, sexual orientation and gender identity get intermingled. So I'm going to go into the breakdown of these as well in a little bit. We have TGD. This stands for transgender and gender diverse. And gender diverse really describes people whose gender identity falls outside of that traditional binary categories. There are many different identities and terms used under this umbrella term, so we'll go over that as well. Some gender diverse people can feel a mix of more than one gender. Some might also feel like one gender some of the time and sometimes not feel like a gender at all. So lots of variations. And then HRT, which you might see sometimes as well, stands for hormone replacement therapy. So I want to first explain the difference between sex and gender. Sex refers to biological characteristics such as the reproductive, chromosomal, and hormonal characteristics, whereas gender is more of a social construct and it's separate from biology and it's not binary. So when we talk about SOGI, sexual orientation is a person's identity in relation to the people to whom they're attracted to. Whereas gender identity is the personal sense of one's own gender. So if your sense of gender correlates with the sex you were assigned at birth, you would identify as cisgender. If your sense of gender differs from the sex you were assigned at birth, you might identify as transgender. But trans is also an umbrella term that can include a variety of different identities as well. Gender identity tends to form more during toddler years, but it can change and evolve throughout a person's lifetime. So sexual orientation, as a recap, is more about that attraction to other people, which is external, where gender identity is more of a deep-seated sense of self, which is internal. And last, then, we have gender expression. So this is really the physical manifestation of one's gender identity through things like clothing, hairstyle, voice, body language, things like that. It's typically referred to as masculine or feminine. Gender expression can be congruent with a person's gender identity, but it can also be incongruent if a person does not feel safe or supported, or maybe just not having the resources needed to engage in that gender expression that authentically reflects their gender identity. So there can be a lot of different reasons why it's either congruent or incongruent. Ultimately, it's important to remember that terms and language are very personal to someone's identity and body parts, and how someone might appear doesn't determine what their gender identity is. Questions so far? Okay. Okay, so remember, sexual orientation is a spectrum and can be fluid, and people can use a variety of different labels to describe their own orientation. So I'm not going to go into detail on all the types of sexual orientation, but I'm going to review just a few, just some that might not be as known, or maybe you've seen them before and really weren't sure what the differences were. So asexual is a person who does not experience sexual attraction towards other people. They may still have romantic attractions to others, though. So asexuality is very distinct from celibacy, which is deliberate abstention from sexual activity. But some asexual people may actually still choose to have sex, even though they're not experiencing that sexual attraction. Bisexual is a person who is attracted to more than one gender. So this is a really broad definition. Something to know about this group of people is that bisexual people are often excluded or rendered invisible in LGBTQIA plus spaces because sometimes they are assumed to be either straight or gay based on the person they're currently with. Demisexual describes a person who only feels sexual attraction to someone after they've formed a strong emotional bond with them. So compared to the general population, most people who are demisexual rarely feel sexual attraction. And then you have pansexual, which describes a person who is emotionally, romantically, sexually, affectionately, or relationally attracted to people, regardless of their gender identity or sex assigned at birth. So I think sometimes there's people don't understand the difference between bisexual and pansexual. And the main difference is that bisexuality means attraction to more than one gender, while pansexuality means attraction regardless of gender. So just small variations, but definitely a distinct group of people then. Same as sexual orientation, I'm not going to go through all the types of different gender identities, but probably some more of the common ones as well. So I mentioned cisgender before. Cisgender is a person whose gender identity corresponds with the sex they were assigned at birth. So you might see these abbreviations as well. You have assigned female at birth, and this is based on physical anatomy, or assigned male at birth. So that's the AFAB, AMAB. And then you have transgender. So a person whose gender identity does not correspond with the sex they were assigned at birth. And again, trans is an umbrella term. You might also see the FTM, which stands for female to male, or MTF, which stands for male to female. But typically, so you might see these more in medical writings and things like that. And that's really the only place we should be using those kind of abbreviations or term, because it's better to refer to someone as just man or just woman or trans man or trans woman, because stating the first part, the female to male or male to female, implies that an individual was once the other. But that really isn't the case. They have always been who they are. So we want to avoid using those terms. Also want to avoid adding ed or ing at the end of transgender. Sometimes you might hear that it's a person is transgendering or is transgendered. This is not something that happened or is happening to a person. This is who they are, same as a cisgender person. Does that make sense? A few more terms related to gender identity. So agender is often used as an identification for people who do not identify with or conform to any gender. Gender fluid describes a person whose gender identity is not fixed and can vary. And gender nonconforming describes a person whose gender expression doesn't subscribe to gender expressions or roles expected of them by our society. So again, very unique in the description, but also can be pretty similar. You have genderqueer, which can define a person whose gender identity or expression falls outside of the traditional binary categories. And then you have non-binary, which is an umbrella term describing anyone whose gender identity falls outside of that binary. So you might also see this. Sometimes you'll see it as NB written out the way it shows here. Sometimes you might also see it as the actual letters of N and B, but we've moved away from that because NB also, its original meaning stands for non-Black people of color and was created by Black American women activists online to talk about racism. So if you're going to go with non-binary and abbreviate, then NB in terms of the written out is most preferred. And I mentioned two-spirit earlier. So two-spirit is an umbrella term as well, but to encompass a wide variety of gender variants within the North American Indigenous and Canadian First Nation people. So specific to those cultures and not just a general term to describe people. I know that was a lot of terms and breakdowns. So again, remember, I have a handout later for you that will go through all of these as well in case you didn't remember all of them right now. So some of you might be familiar with the gender unicorn or maybe the genderbread person, but this is the gender unicorn. It was developed by the Trans Student Educational Resources. It's a youth-led organization dedicated to transforming the educational environment for trans and gender nonconforming students through advocacy and empowerment. The gender unicorn is a way to help explain how gender identity, gender expression, sex assignment at birth, and attraction are different and distinct from one another. So each arrow is a sliding scale, it's not a checkbox. And this, while the lines on the gender unicorn charts appear linear, gender is not. So it shows that gender is movable and fluid across each category. So if you actually go to this website here to learn more about the gender unicorn or the TSER, there are also versions of this form that are not colored in terms of the spectrum. So you can use it as a tool if you're working with people, kind of have them gauge their own categories. Okay. So I want to move on now because I brought up at the beginning that those in this population may face different challenges and barriers compared to those who don't belong to the LGBTQIA plus community. So some of the barriers to receiving care include limited access, negative experiences, and lack of knowledgeable providers. So when it comes to access, they are less likely to have health insurance or their insurance doesn't cover the gender affirming treatment that is needed. um, they may also have limited routine preventative care, especially if their body parts are not congruent with the sex assigned on their insurance. So, example, a trans man with male on his insurance might be denied coverage for a pap smear test. So, things like that. Um, they may also face barriers to accessing their records and getting proper identification. There's a lot of forms that need to be filled out or proof of. So that's a barrier. And even if they end up receiving care, they might not receive gender affirming care, which is different. Um, in terms of negative experiences, these can include being misgendered or not being referred to by the correct pronouns, being forced to choose certain options on a form if the form is limited. And if going to certain places, they might also lack gender neutral facilities, things like bathrooms, locker rooms, depending on where they're at. And as I mentioned earlier, they may experience discrimination or prejudice from staff when seeking care. A reason for this might be due to providers not having knowledge or experience in caring for this population. Sometimes this is due to lack of education, but more so it could be part of a person's bias, their ignorance, or just maybe discomfort with working with this population. I hear that or I see that my words are coming out in an echo. Can you hear me okay? Okay. Let me know if it's an issue. I can try to speak differently. Okay. So, due to the barriers previously discussed, it should be no surprise that there are many challenges and risks that individuals in the LGBTQIA plus community face. So, some of these are pulled from the National Sexual Violence Resource Center. Um, but might face bullying, discrimination from family, friends, colleagues, but also from systems such as employment, legal, housing, and medical organizations. You have familial conflict. Some people might be disowned by their family or just not, that lack of support and understanding. Gender dysphoria. So this is distress experienced by some people whose gender identity doesn't correspond with the sex assigned at birth. This is also in the DSM-5. Distress is clinically significant and causes impairment according to the diagnosis. Um, this disorder is higher among transgender and gender diverse people, but it's also important to note that not every individual who identifies as transgender or gender diverse experiences significant impairment or distress. But having a diagnosis of gender dysphoria is often required for insurance to approve certain treatments. Harassment can be facing threats of violence, harm, a lot of health risks. So I'm going to actually go into that in a little bit more detail after. Homelessness or just on being unhoused. There are often youth are kicked out of their homes. Incarceration. So usually this is from obstacles that they're facing if they are unhoused and needing to survive and getting into legal issues. So incarceration it could be higher. Intimate partner violence. So they might have higher experiences of rape, physical violence, and or stalking by an intimate partner as well. There's a lot of invisibility that is faced by this population, and this goes along with isolation. So more than 50% of LGBTQIA plus workers in a study in 2020 reported having to hide the nature of their personal relationships out of fear of hostility at work, just to avoid that discrimination. Lack of representation. So this can be lack of diverse and inclusive, accurate depictions of LGBTQIA plus people in media and culture, but also there's also an underrepresented in certain career fields as well. There are mental health problems, so higher risk to experience mental health issues, and I'm going to go into this in more detail as well. Poverty, more likely to experience poverty than their straight counterparts, and this is tied to higher rates of employment discrimination, housing discrimination, difficulties in terms of medical treatment, might have to pay more because their insurance isn't covering it. Racism, so people of color within this community also face additional discrimination even from their own community. Rejection by friends, family, loved ones, sexual assault. The risk of sexual violence is increased also for trans people. There's a lot of stigma that we know of already with this group of people. Higher substance use rates that I'm going to talk about as well. And suicide. So suicide is actually a leading cause of death for LGBTQIA plus people ages 10 to 24. And they also attempt suicide at a disproportionate rate. Youth especially are more than 5 times more likely to die by suicide than their heterosexual peers. So transphobia, this is in 2020, there's a record-breaking number of murders against trans people, especially within that population, women of color. And I'll talk about that a little bit more too. As I mentioned, there's a higher, there's trauma involved, obviously from everything that we've talked about already, higher risks of unemployment, violence as well. So LGBT people are 4 times more likely to experience violence compared to their straight counterparts as well. So just looking at this screen, there's a lot of bubbles here. And I only talked briefly on some of them. So a lot of challenges that the LGBTQIA plus population faces. And with these challenges lead to other negative outcomes in terms of health disparities, in terms of higher risks of substance use and mental health issues. So I'm going to go into that next, but any questions so far? Okay.
Questions yet? No.
Nope, I'm not seeing any. Okay. So the challenges and barriers that we discussed so far were really all inclusive of all individuals in the LGBTQIA plus community. The next couple slides are more specific to the transgender and gender diverse population. So based on a number of challenges and barriers that were just discussed, there should be no surprise that the TGD people experience disparities in healthcare and health outcomes. So things like there are higher rates in mental health disorders, substance disorders, suicide, and tobacco use. So tobacco use is also much more prevalent among TGD adults compared to their straight and cisgender counterparts. But when we take a look at the transgender and gender diverse populations, a lot of these higher rates can also one reason can be because of transphobia, and I mentioned that earlier. So transphobia, according to Merriam-Webster Dictionary, is the irrational fear of, aversion to, or discrimination against transgender people. So when it comes to provider knowledge of transgender healthcare, in 2019, a study was done about providing care, and it really didn't come down to providers improving their competence working with this population, but rather it was the transphobia that was more of a barrier to treating this population. Other health disparities would include cardiovascular health, HIV, and cancer. So cardiovascular health, this is primarily due to being exposed to more psychosocial stressors. When it comes to HIV, the access to services is lower for this population than compared to the rest of the population, and they are at 13 times higher among the adult population to be at risk for acquiring HIV. And then for cancer, so this research is in this area is a little bit limited. However, in 2021, the National LGBTQIA Plus Cancer Network released their gender expansive executive summary and found that gender expansive survivors are 2 times as likely not to disclose their identity to cancer healthcare providers and were 3 times as likely to report their care was less welcoming once they did disclose their identity. So it also found that gender expansive folks are less likely to receive recommended cancer screening. So there's a lot of bias, transphobia involved in all areas of healthcare. And trans men have difficulty accessing screening for cervical cancer. And then lastly, mortality. There are higher rates of mortality amongst that transgender population and gender diverse population, but even within that population are racial differences in terms of higher rates of mortality, and those who are who identify as people of color have higher rates as well. So in addition to health disparities, there are also psychiatric disorders that are higher amongst this population as well. According to the National Alliance on Mental Illness, they're actually almost 4 times more likely to experience a mental health or substance use disorder. A study that was done in 2019 was looking at mental health diagnoses among transgender patients in a clinical setting, and they found that approximately 58% of transgender patients had at least one DSM-5 diagnosis compared to 13.6% of cisgender patients. Some of the more common diagnoses seen amongst this population is major depressive disorder and generalized anxiety disorder being the most common. But other diagnoses that are at a higher prevalency was bipolar disorder and psychotic disorders, including schizophrenia and schizoaffective disorder in transgender adults. Also, youth of this population are twice as likely to experience depressive symptoms, consider suicide, like I said, and attempt suicide. Other diagnoses that are more prevalent that are not listed in this population include just stress, but more specifically gender minority stress, which refers to social stressors such as discrimination and stigma that gender minorities face. Another common diagnosis or higher prevalency are eating disorders. Okay. So I know I talked about a lot of negatives in the last couple of slides, but also in spite of all the barriers and challenges the LGBTQIA plus population can face, there is good news that being provided gender-affirming care can lead to positive health outcomes. So the Trevor Project, they did a national survey on LGBTQ youth mental health, and when youth were provided gender-affirming care, several positive outcomes followed. So that included lower rates of suicide, lower rates of depression and anxiety, lower rates of self-harming behaviors, and decreased overall behavioral and emotional problems. So it does have a positive outcome as long as they are receiving that gender-affirming care. So knowing what the benefits can be, this piece is really knowing what to do. So to combat and prevent the barriers and challenges we discussed, there are really these are just a few simple things that we can all do to provide gender-affirming care. The first is starting off with names and pronouns. So making sure to use a person's chosen name and pronouns when they are provided. And I like to say that piece of it or emphasize the piece of when provided because pronouns are personal and not everyone is ready or feels comfortable to share theirs or feels safe enough to share their pronouns. So it's important that we don't require anybody to share their pronouns. But you can open up the window to show that it is safe and you're gender affirming to share your pronouns when you make introductions, when you have signage around to let someone know that this is a safe space for them. So when someone does provide their pronouns, though, it's really important to ask regularly and routinely because pronouns can change. Can be gender fluid. So we want to just check in and make sure that you're continuously using the right pronouns. Also, just make sure that you're using them correctly. And then if you're working with other staff that maybe don't have as much contact with the person, just let your staff know as well so that it's not something that has to come up on a regular basis of misgendering and then having them be corrected. Just share with your team, those that need to know. Apologize when a mistake is made. So mistakes will happen. We are human. And again, if someone is gender fluid, their pronouns might change. It's really important, though, not to linger on the mistake and take accountability for your actions. Sometimes lingering or over apologizing can cause more harm. And sometimes an apology won't be enough, but that could be due to the history and trauma of being discriminated against on a long-term basis. So it's important that if someone doesn't accept your apology or has a negative response to it, it's trying your best not to take someone's negative response personal because it's really not about you. It's about everything that they've been through previously. Avoid asking unnecessary questions. I think this sometimes comes up. We get curious, but you want to avoid asking inappropriate or invasive questions regarding one's body, genitalia, or sexual practices that typically won't have anything to do with what you're doing with that person if you're working with them. So you really only want to ask what's medically and clinically necessary. And if you're in the health field, you might have to ask certain questions, but it's not something that always has to come up or always has to be known. Avoid assumptions and stereotypes. So avoid trying to fit gender diverse individuals into categories or boxes created by societies or with a cisgender bias or a heteronormative bias. You want to also avoid backhanded compliments. These can be seen as microaggressions. So saying things like, I couldn't tell you were gay or I didn't know you were trans. Maybe it comes off as a compliment to you, but it's not. These are microaggressions, so you want to avoid that. Help them feel ordinary. So it's important to make sure that you're having a conversation with them just as you would with anyone else that we're working with. You want to make sure that they know that there's nothing wrong with how they identify or express themselves. Ongoing learning and education. So as I mentioned, language is constantly evolving, but there's always new research out there. So it's important to try to stay on top of things as much as possible. Also continuing to learn about individuals specifically, but making sure that you're asking permission before you just go out and ask all the questions that you're curious about. If you can do the research first, I would encourage that. And then reach out to those that you feel that are comfortable answering those kind of questions. And then I mentioned a little bit earlier is creating a safe space. So in terms of creating a safe space, that would involve not disclosing private or inappropriate information to people that don't need that information. We don't want to accidentally out somebody, give out personal details, anything like that. You also want to avoid your values and beliefs on others. So, or avoid forcing your values and beliefs on others. Everyone is entitled to those beliefs and values, but when it comes to the professional work that we're providing, you don't have to force that on anybody else. It's respecting their wishes. So being mindful of that, avoiding offensive or inappropriate language, or even jokes about this community, whether or not you think someone's listening. We want to have integrity and be appropriate even when no one's around, even if you think no one's around. And also correcting your colleagues or coworkers if they should make a mistake. It's standing up for someone. It's being an ally for this group of people when even if they can't defend themselves. And ultimately, it's really to create a safe space. You really want to incorporate an intersectional approach. Everybody has multiple identities that they belong to, and they all intersect with each other, either to create levels of oppression and discrimination or privilege. So it's really looking at the whole picture, the whole person, and not just one element of that person. Okay. Thoughts, questions so far? Okay. Just a couple more things. So given that we're in New York State, I just wanted to give a little bit of history in terms of our New York State Division of Human Rights and how it might impact providers if we're not providing gender affirming care. So, New York State was the first to enact a human rights law, which affords every citizen an equal opportunity to enjoy a full and productive life. So, the New York State Division of Human Rights, or DHR, was created to enforce this law. So, although this law got its start in 1945 and focused on employment, it's ended up stretching to housing accommodations, non religious educational institutions, places of public accommodation, commercial spaces, and credit transactions. So, I'm hoping this will work. Yes. So, this is kind of gives you a summary of making sure that you understand your rights in terms of the LGBTQ plus community. So I'm not going to go through this whole thing, but just kind of showing it goes over an overview. I'm going to get these pop-ups. Um, and then talks a little bit about the human right laws protection. So they focus on SOGI, again, the sexual orientation, gender identity, and expression. Um, it gives you a little breakdown of what that means and also examples of discrimination, should you not really be sure. But this prohibits discrimination upon actual or perceived sexual orientation. This also involves covers protections for persons living with HIV or AIDS. It was protected under the disability provision. And if a complaint is made, so there is a complaint process. So if a complaint is made and determined to have probable cause, there's a public hearing, and this will kind of go through your process if you are one to make the complaint or if you might be on the other end of that. And then just a few other protections for the LGBTQIA plus community includes the passing of marriage equality. Whoops. Oh, it went away. But the passing of marriage equality, banning conversion therapy, banning gay, trans panic as a legal defense in court. So if you're not familiar with that, according to the American Bar Association, previously, people would seek to partially or completely excuse crimes such as murder and assault on the grounds that the victim's sexual orientation or gender identity is to blame for the defendant's violent reaction. So that is no longer a defense. That defense is no longer legal to try to do. Ending the HIV/AIDS epidemic, and then enacting GENDA, which is the Gender Expression and Non-Discrimination Act, which was passed in 2019. So those are just a couple in the last few years. Lastly, I don't know if this is going to work, if we even want to try.
I want to try.
Okay,
I don't
so
know if it will work.
we have a video. It's only a couple minutes, but I think it kind of sums up all that we've discussed already on what gender affirming care is and what it's not. So how?
Okay, 1, 2, 3, click go.
Okay.
It's time to set the record straight on what gender affirming care is and what gender affirming care is not. Gender affirming care is age appropriate care that is medically necessary.
It actually is playing for me.
Many transgender and non-binary people who experience symptoms of gender dysphoria. Gender dysphoria is distress that results from having one's gender identity not.
Amy, are you able to pause yours?
Every major medical.
Awesome. Okay. For some reason, it wants to play now.
And mental health organization.
I need to play the audio part. So
okay,
we'll just let this catch up a second and then we'll go. If it doesn't match, you can read along or listen.
Says that it is medically necessary to support people in affirming their gender identity. That's more than 1.3 million doctors in the United States, including the American.
Which minute are you on? I can actually keep it together. Do you want to try to just start from the very beginning again?
Let's do it.
Okay. 1, 2,
okay,
3.
Sorry, everybody. Okay, I'm at 0.
Me too.
Okay. Let go now.
Yep.
It's time to set the record straight on what gender-affirming care is and what gender-affirming care is not. Gender-affirming care is age-appropriate care that is medically necessary for the well-being of many transgender and non-binary people who experience symptoms of gender dysphoria. Gender dysphoria is distress that results from having one's gender identity not match one's sex assigned at birth. Every major medical and mental health organization says that it is medically necessary to support people in affirming their gender identity. That's more than 1.3 million doctors in the United States, including the American Medical Association and the American Academy of Pediatrics. You should know that transition-related or gender-affirming care looks different for every transgender and non-binary person. Parents, their kids, and their doctors make decisions together, and no medical intervention with permanent consequences happen until a person is old enough to give informed consent. So what can gender-affirming care look like for young kids? For most youth, transition is entirely social. It might be a new hairstyle, new clothing. Therapists, parents, and healthcare providers work together to determine which changes to make at a given time that are in the best interest of the child. None of this care is irreversible. And for older youth and adults, gender transition is a personal process that can include changing clothes, names, and pronouns to fit a person's gender identity. Some people take medication and some do not. Some adults have surgery and others do not. How someone transitions is entirely their choice to be made with their family and their doctor. What about surgery? Surgery is only for people who can give mature, informed consent. Also, there's no such thing as the surgery. Some people need to have various kinds of surgery that help to reduce the distress and discomfort they feel about their body. Many people never have any surgery at all. All gender-affirming care is age-appropriate, medically necessary, supported by all major medical associations, and in many cases, life-saving. In order to live authentically, I needed to access care. I would not be a trans adult if I didn't have the support as a trans kid to receive the care that I deserve. Transgender youth who have access to gender-affirming care have dramatically lower rates of depression and dramatically lower rates of suicide, lower rates than with non-transgender youth. One of the most important things that I can say to all folks as a Black transgender woman is that believe us. Believe us when we tell you that we're experiencing distress or when we show you that we're experiencing distress. Believe us when we tell you about our gender identities, when we feel safe enough to do so. And believe us when we say that we need gender-affirming care.
Okay, so glad that worked. And then I know we only have a few minutes left, so I just want to say thank you for your patience, especially with all the technical issues. But creating an affirming and inclusive environment for LGBTQIA plus people really requires a combination of understanding them as a population while treating each person as a unique individual. It might feel complicated at first, but really, if you're in this work of serving this population or any population, there really shouldn't be too much difference in terms of the respect and treatment that we provide those that we serve. Effectively serving LGBTQIA plus patients requires us to understand the cultural context of their lives and to modify our procedures, behavior, and our language to be inclusive, and non-judgmental and helpful at all times. So ultimately, we want to make sure that we're taking that cultural humility approach of apologizing if you make a mistake, because we will make mistakes. I make mistakes all the time. And continuously wanting to learn and get better, and just be open to someone else's experiences, even if you don't understand or agree with. And lastly, I know I apologize for the time that we didn't have enough time for questions and answers, but if you do want to chat further, this is my contact information. So it's Loughran at horizon-health.org. You can also give me a call. And if you want to just learn a little bit more about Horizon Health Alliance, our website is available. This presentation will be made available, but I do want to just point out we have some resources. So I picked some local Western New York organizations that work with this population, but also things on national advocacy, lobbying, and educational resources, organizations just specific to health in terms of mental health and substance use treatment, some legal resources as well, resources for families. We work closely with PFLAG, and then some other clinical organizations that might be helpful if it's something that you're not able to provide yourself, and then just some references. So again, thank you so much, and I'm so apologies for all the technical issues.
Just a few quick things. Just wanted to thank you, Jen, for a wonderful presentation. And again, just thank everybody for hanging in there through our technical issues. Amy has actually posted our evaluation for this training. It's just a few quick questions. So if everyone could just take a minute and fill out that evaluation, that way we can continue to improve these trainings. Also, feel free to put on that evaluation any trainings that you're interested in hearing in the future, any topics you're interested in, or if you know someone who'd like to be a presenter, share that with us as well. We do have a special session of our training series coming up next week. We actually have Krista Focio be back. She's a JD MSW and the Director of Quality Improvement and Training with CCNY. She's going to be presenting on CQI 101, which will be an overview of the fundamentals of implementing quality improvement. This will be Thursday, June 29th, which is next Thursday from 9 a.m. until 11 a.m. The registration link is on our website, and Amy will post that in the chat as well. Stay tuned for future information on our upcoming July training as we're finalizing those details. Again, the presentation recording here from Jen will be posted afterwards. And Amy posted that link as well to our website, which also has our previous trainings for anyone to take a listen to.
And I just posted my email address in the chat as well.
Wonderful. Well, thank you again, Jen. That was fantastic, great information. A lot of the comments coming in here were what a wonderful presentation that it was, and that you were able to communicate the information very well and very knowledgeable. So
thank you so much.
We appreciate it. And again, thanks everybody for working through the technical issues with us.